welcome everybody to this MRC webinar on the new unit funding model. I've got a number of slides that I'll talk through at the start of the meeting, and we'll have plenty of time for a question and answer at the end. The whole webinar will be recorded and in due course placed up on the web, and the slides made available as well. So, okay, over to the first slide, please. So, by way of introduction, I'm Rob Buckle, MRC Chief Science Officer as well. So in terms of updating you on where we are, why we're here and what we're announcing, the background to this whole process was established through an MRC unit and centre portfolio review. And as many of you will know, that confirmed that we should continue to invest in strategic long-term investments, but that we should adapt our approach and set up a new major investments board to oversee this. And where we've ended up was developing a new unit funding model that combines the best aspects from existing unit and centre formats. And in doing so, we're seeking to provide a funding model that really promotes bold, long-term interdisciplinary science that's really able to capitalise on a particular opportunity or challenge, and provides a world-leading position for the UK. We wanted to do this through a simpler, more transparent and easy to understand costing model, meaning it's more aligned with the standard way of grant funding across UKRI. And in so doing, that would create an approach that's more amenable to partnership with other members of UKRI and other funders who would, to some extent, again, have a simpler view of how this would be operating. The other aspect, of course, was in designing something that minimised the administrative burden of both the review and the call administration and the response of the hosts and applicants. And so we're seeking to simplify and streamline the review processes that would previously be known as the quinquennial review process. But as you know, we're moving to a 7-year timeline for this model. And all of that is meant to help it become simpler to operate for the host research organisation. Next slide, please. So just to remind you of the key features of the new unit investments, and I should say at the outset that the precise branding for this will be announced in due course, but we're using new unit to cover the description at the moment. So these investments will have a mission to address a specific goal or challenge, and something where we consider that either a disruptive approach or long-term interdisciplinarity is going to be required to crack the problem. The investment timeline envisaged is 14 years, so that's a 7 + 7 year investment model. And the expectation from how these will be reviewed at the outset is that they will last 14 years. So it will only be if things go off the rails at midpoint that we would close an investment earlier. These investments need to be distinctive and explain why they are needed, both in terms of format and design, to make a difference. We're typically modelling these on an expected budget of £3 million per annum over 7 years, and a little bit more about what that covers in due course. These investments need to be nationally visible. They need to be internationally visible, I think, if they're successful. And we certainly expect, with this amount of funding and focus, that part of that contract, if you like, is to ensure that these are outward facing and work for the wider community. And firstly, that should be through stimulating a training environment and allowing people to come through and move on with all the positive aspects of a responsible research culture. And also that they are beacons of open science and sharing resources and knowledge. They need to be led by an empowered director or directorship team we are really sort of looking to make sure that the leadership of these investments is what we would consider a modern leadership approach, and not down to a unitary all-powerful figure, for example. And that the leadership team, by being defined with clear roles and remit, and the potential for rotation even in terms of leadership, that leadership team would have control of the core budget, the strategy, and the appointments to be made. These investments could be hosted by either a single eligible organisation or a partnership of organisations. And we're certainly very interested to hear bids that span different institutions, because we would rather see things that really captured the best expertise to solve a problem than be constrained by the thinking of who is in a particular location at a particular point in time. These investments will be administered through terms and conditions specific for the award. For those of you familiar with our previous unit investments or ongoing unit investments, these have a particular legal agreement with the university, but we consider we can achieve what we want through specific terms and conditions. And the budget is being provided under the usual UKRI format, which is to provide 80% of the full economic costs of the proposal, with the remainder obviously to be filled through the REF contribution under the dual support system. And there's a clear expectation that the CoRE award must lever both existing grants in its establishment, but also be well positioned to win further grants, whether that's projects, programs, or training, and to achieve growth and sustainability across this period of time. And this, of course, should be a win-win for the ambition of delivering the mission, but also for the research councils and the host university in terms of developing a strategic partnership to deliver impactful research. Next slide, please. So just to inform you that we have set up a new major investments board. The terms of reference and the membership are on our website. That has met 3 times to date. And firstly, its remit is to oversee the funding for our entire major investment portfolio. So as well as this new unit scheme that covers our institutes, our existing units and centres, and other large national investments such as major platforms or cohort studies and the like. The MIB also has a role to horizon scan and think of areas of opportunity for new strategic investments. That will be, through things MRC promotes itself, or in response to opportunities for partnership from others. And the MIB will also think through how the outreach opportunities and networking options across the entire portfolio maximise the value and impact of them. And the membership currently is 14 strong. It includes the 5 MRC board chairs, a couple of council members, and some independent expertise, and covers the sort of breadth of the biomedical and health space that I think you'd expect to see. And it's chaired by John Iredale as executive chair for MRC at the moment. So we have pre-announced this, as I'm sure many of you will have seen, that the first round of this new approach to funding is going to be based around 3 particular themes, where MIB saw a pressing need to move forward and an opportunity to align with other developments. The long-term intention is for this funding scheme to become response mode to the best ideas, but there will certainly be a thematic basis spanning the first few years. And beyond this first year, we will be releasing details of future themes in due course. So the expectation is that we will fund something across 1 or more of these 3 themes through this call. The call will be a two-stage call, and the outline opportunity will open in the first week of November this year, and then move through that timeline on the top of the slide, such that the full opportunity for invited applications will open in May 23, with full applications to come in September 2023. And then an application assessment process, more of which later, which would end up with 1 or 2 new units being awarded in March 2024. Okay, next slide, please. So to remind everybody, we want these investments to be defined around the research challenge that they are going to tackle. So this obviously needs some careful thought about what is really something that is both bold and ambitious, but tractable over a period of time of 14 years. These challenges need to be defined by stating what will be transformational in their approach to either a biomedical challenge or a health research issue, and that will, in time, through both the investment and longer term outputs, change our approaches to one of prevention, early detection, diagnosis and treatment, and obviously aligned with MRC's overall mission. As well as addressing a challenge, it's essential that these investments become beacons of excellence in the correct approach to a positive research culture and an inclusive research agenda, both in terms of workforce and research approach. Next slide, please. So, by way of a brief summary, these strategic investments will firstly be bold, ambitious and innovative, and something that cannot be done just through sequential grant funding. And they will address what is up for you as applicants to define as the urgent knowledge gap or critical challenge in the field, which needs focused attention and can't be done through other mechanisms or elsewhere. The investment should define specific goals achievable within a 14-year time frame, which, as I've mentioned, should be transformational for the particular research field or health research area it's operating in. And in doing so, it needs to bring together creativity and obviously new approaches. What is different about what's being proposed here that will change the impact trajectory of this, and how will that be integrated through cross-disciplinary working? The challenge is really meant to address a substantial unmet need, and as I've stated again, needs to be through coordinated, flexible funding, and the reason and rationale for that approach has to be stated within the application at the outset. We obviously want to foster both translational activities, innovation, and capacity and capability through these investments, and ultimately drive the breakthrough advances and things that are available to address bottlenecks in the field of translation, or through knowledge gaps or technological innovation, where we need either technological, methodological, or innovation and clear translational relevance. Next slide, thanks. So who can apply? Well, the normal applicant criteria exists in terms of UKRI eligibility. For the principal applicants, they must clearly be employed by an eligible organisation and have the expertise and experience that would be required to lead a centre of research excellence in the field in question. We are very open to these investments incorporating international activity. We wouldn't allow an international organisation to lead an application, but where it's appropriate and a particular contribution could be defined through an international, whether it's a team or or an activity, then that could certainly be incorporated into the bid. But clearly, again, it has to be defined what is distinct here that couldn't be found through other parts of the UK. We do expect the research and management teams to be diverse and inclusive. That's, you know, in terms of expertise and team profile, but also including those in different career stages and those with protected characteristics. Partnerships are encouraged, whether they are at the outset in terms of the core funding and the foundation, or whether they evolve during time. Partnerships in terms of the applicants can be from single eligible organisations or as a partnership. But obviously what we're very keen to understand when applying as a partnership is clarity on how this will be managed successfully, how this will allow a flexible and evolving research approach to be managed across two or more participating organisations, and avoiding ossification in terms of money being set into one institution or another for the long term, which obviously would be counter to a flexible and dynamic research activity. The way this will work in terms of funding allocation is that there will be a lead organisation. That lead organisation would have responsibility for managing the partnership and distributing the funds afterwards. Next slide, please. So these are, you know, significant long-term investments. They have to be operated in a host environment that is encouraging and strategically aligned. And as such, to make these investments work, we are asking research organisations to clearly define the support they're going to provide. This is a serious commitment over a long period of time that's required. And for example, that would cover the provision and maintenance of the lab space and the facilities, access to wider facilities that would be seen to be supportive, whether of a technical or policy nature, human resource services to underpin the activities, and of course, underpinning salary support for key staff positions. Because of this requirement for long-term and strategic partnership, at the very outset of the application process, we will be seeking a letter of support to be provided from the lead organisation and contributing organisations if it's a partnership, which would need to be submitted at a very senior level, whether it's Vice Chancellor, Vice Principal of Research or equivalent, Head of School, etc. Organisations thinking about this are obviously encouraged to prioritise their own involvement in the bids. I mean, I don't think it would make much strategic sense for a particular university to send in 3 applications in the same area, for example, that would be competitive with each other. So we think this will be naturally managed, but we will keep open a view on whether we would need to offer some guidance in terms of how many applications would come in. We are conscious of trying to manage realistic application demands relative to the number of these activities that can ultimately be funded. For example, remember in this first call, we're funding up to 2 new units across the activities advertised. The next slide, please. The funding model, the budget will be provided as a grant, and as already mentioned, under the 80% full economic costing model. We've gone this route to ensure that the approach is readily partnered across UKRI, where there's opportunity for other parts of UKRI to see co-investment opportunities here. And it also provides administrative simplicity for the host organisation in terms of UKRI investments all being in the same format. The core awards should lever existing grants, as I've again already mentioned. And the issue of winning additional grant support is both to clearly expand the activity and the reach of what's going on, but also ultimately provide sustainability in the longer term. While we see these as time-limited investments for 14 years, judging by the previous example of time-limited centre investments, which had 10-year funding, there is a real opportunity to create sustained activity around a certain brand over a longer period of time. And in terms of expectation, we would certainly consider that success would look like a minimum of 100% leverage through other grants and fellowship investments on the core investment by the midterm point, meaning year 7. And certainly that will be a consideration at the midterm review point. Next slide, please. So in terms of what a typical core award would cover, I mean, as always, there are always exceptions to these things, but this is the sort of general view of what should be allowable and supported through these awards. We would imagine that the investment would constitute a limited number of interlinked themes or work packages in some people's terminology, and associated capabilities and research or technology platforms. We sort of clearly expect to see these focused on the key objectives. What is the challenge and how will it be addressed? And to some extent, articulated over the course of a 14-year lifespan, such that we can understand what the near-term and longer-term outputs are likely to be. And as is inherent in what I've said, we won't be pursuing this through the previous unit model of seeking individual investigator-led programs to be identified, which would be reviewed independently, and the added value of those identified. Rather, we want the bids to be defined around research themes, of which there will be a fluid and flexible number of senior investigators and junior investigators associated with them. Those themes and the investigators that are associated with them would most likely change over the course of 14 years. And there may be very good reason to start with a different research team to the ones that might end in the 14-year period, whereby the type of research being delivered may have evolved significantly. But again, that's up to you to define what that should look like and how that would operate. In all cases, we expect the investigators and the research team to be supported by their own portfolio of grant funding. That we would anticipating that for de novo units or centres of excellence, the investigators identifying themselves as applicants would already have funding support. And again, they will be contributing a % of their time to this investment, but also pursuing other research in aligned areas through other grant support. And I think that's a healthy sort of perspective, both for individual investigators and for the sort of growth and sustainability of the investment. We are open, as I mentioned, we would be supporting percentages of salaries of investigators through this award. But we are open to exceptionally support investigators 100% in terms of salary provision for a limited period of time, typically 2 or 3 years, where those investigators are critical for the delivery of the research themes, but whereby they can't be expected to have existing grant funding. And the obvious examples there would be people who are being brought across from outside of the UK, or those that might be hopping disciplines or coming in from industry or whatever it might be. So again, this is designed to allow flexibility to allow the teams to assemble the very best spread of expertise required. Next slide, please. So again, the CoRE Award is expected to offer funding for the research themes, within that to pump prime activities and support the development of new opportunities, which might be sustainable through additional grant funding aligned to the mission of the investment. The technology and data platforms that might be required to provide the facilities and capability. And of course, any mid-range or even large equipment that's absolutely necessary to establish critical platforms or facilities related to the mission. And external stakeholder activities, including public engagement and involvement, are an important aspect of the activity. Now, I mean, these figures are always dangerous to put up in the context of inflation rates that are changing by the day. But in terms of where we were at the beginning of the calendar year and the indexation, we would expect a £3 million per annum award to accumulate to a lifetime award of in the order of 53 million over the 14 years. So I think when you look at it at that level, that's a significant amount of long-term investment to sustain an activity and build quite a broad base of aligned research activity as well. Okay, next slide, please. So just a few aspects now to give a little bit more depth in terms of some of the other aspects that we are looking to support here. In terms of training and careers, I mean, the obvious thing is that these investments and the challenge that they are trying to address will require people to be trained, and these are ideal vehicles to build research capacity in the specialist area. There should also be an advantage of being involved in these investments in terms of applying for response mode schemes, so a little bit more at the end about that. But we'll be looking for a training environment within these investments that allows people to really grow their capabilities and transition between career stages. The offer of long-term funding through this model is significant, and therefore that allows people potentially to think about training needs in a slightly different way. So again, we would encourage some creative thinking about what could be done here. And of course, in doing so, the capability to offer meaningful support and recognition for the builders within teams, as well as the people who traditionally reap the rewards of recognition. And across the technologists cadre, as well as other contributing skill sets that it might be required to deliver an innovative training approach. Now, the money available through this funding is really targeted towards activities that could not be addressed through conventional or existing training and career-focused funding routes. And therefore, as I said, if the ability to support an early career researcher can be achieved through applying to a response mode fellowship scheme, then that's the route to take. And we won't be trying to substitute funding within these units, which could be competitively won through other schemes. And similarly, existing doctoral training programs might be a source, but we do envisage also providing some degree of studentship allocation within that associated with these investments. Next slide, please. Sorry, one is okay. If this is, yeah, thank you. So in terms of research culture, I mean, it's critical that, again, full attention is paid to a positive research culture, and ensuring that the proper sort of routes for developing people and recognizing people are fully embedded in everything that's done. So we need these activities to adopt the highest standards, and obviously there's a lot of dialogue at the moment and different approaches to achieving this, but we would expect a plan to be put in place to cover the 14-year period that explicitly addresses a positive research culture. Now, the current MRC and UKRI policies recognise 3 particular aspects here, which is just worth highlighting. We need to make sure that all of the research that is done with UKRI funding is communicated fully and openly, and the partnership with the public is at the forefront of our thinking. The training environment needs to recognise diversity of talent, skills and outputs, and very much promote team science, you know, and again, moving away from perhaps a more traditional and entrenched PI takes all sort of approach that's been in the past. And that the research, of course, is of the highest standard in terms of its integrity, its reproducibility, the need for responsible innovation, and again, is very open to collaboration, inter and multidisciplinarity. Next slide, please. So the other aspect, which we again need to consider quite strongly in relation to long-term strategic investments, is environmental sustainability and the net zero agenda in particular. When planning such a long-term investment, we feel it's appropriate that there's an explicit sustainability strategy identified. This, of course, needs to align with the host research organisations, which is clearly going to be the main guardian of a sustainability plan. But we need to understand as funders what this activity and the host research organisations are collectively going to achieve in terms of sustainability goals. And in the very first instance, awards would need to comply with the greening government commitments, and we will be requiring reports on this activity and monitoring. And again, these should be flagship investments demonstrating to all that research can be carried out in an environmentally sustainable manner. Next slide, please. So coming to close, monitoring reviews. I think it should be apparent by the structure of the funding in its 7+7 that this is really being set up to simplify the review process, both in terms of its frequency and the needs for the detail within it. For example, we're not reviewing individual PIs anymore, we're reviewing interlinked scientific themes. So there will be a one-hit review at the point of application, assessed through both national and international expertise, really looking at the bid as a whole, and obviously with the usual peer review focus on particular elements of that within. And then once established, there would be a midterm review under a similar process at year 6. We do expect, and we will in fact mandate, that these new units or centres of excellence will have an international scientific advisory board. It will be an SAB that should be demonstrably challenging and have a degree of independence to the leadership team. Obviously, it's for the leadership team to decide who should be on that board, but it will have funder observers on it. And if configured correctly, that will provide a lot of assurance on an annual basis about the trajectory and the success of the funding activity. As already mentioned, a progress review at year 6 to determine the case for the second term renewal. Success at year 6 means the full 14-year term. That is what we hope to see. But of course, we need to manage the fact that not all things will work, and there could be a decision to not renew at that second term. In the event that does happen, we do obviously need to plan for a close down that's appropriately managed and a sort of closed down over a 2-year sunsetting period is how we would approach that. Now, setting research as free for 14 years is great, and that's what we all want to do. We do need to recognise, of course, that there is still some need for annual assurance around certain activities. Obviously, operational delivery, governance arrangement, risk management being things that you just have to understand where you are on an annual basis. And we are still working out approaches to other lighter touch ways of assessing translational outputs or PPIE type of activities and whatever, which again, we would work out how to do in conjunction with the processes I've already said, to maximize the information we can get with the minimum amount of involvement from review process. Okay, next slide, please. So just in terms of the round 1 assessment that's coming up, this will be sort of fully identified to the community in the week commencing the 7th of November. This will be a 2-stage process with the outline focusing on 3 particular areas. The outline will be a fairly brief sort of format, but what we will need to see clearly is the nature of the challenge to be addressed, the strategic support that's being provided from the research organisations in question, and the potential of the leadership team itself. It will involve a short case for support covering those aspects, and it will use the resume for research and innovation that was launched last year by way of collecting background information on the team. The outlines will be assessed by the Major Investments Board, supplemented with a college of experts drawn from both our boards and panels and international reviewers. And of course, given the potential for conflicts of interest and applications coming in from many different parts of the UK, we will have to lean very heavily on international expertise to provide the assurance of an objective view on this. In terms of the full application stage, which will happen through the spring, summer of next year, this will be explicitly reviewed by a largely international peer review process, and will be managed through a specially convened panel for each of the thematic areas, chaired by one of the MIB members. In all cases, we will be assessing applications through interview, as well as written peer review leading up to that. And the timeline set out there on the bottom, but I don't think I need to go through that blow by blow. Next slide, please. Okay, let's got to the end of the presentation. So I will now sort of ask that we go to full screen. We have a small panel to help respond to questions, and we have nearly, well, just over 50 minutes to cover a number of questions. We will do our best to answer everything that comes to us. The questions will be sort of fed to us, clustered around the most commonly asked points. But anything we don't answer, we will hopefully get to through a Q&A document that will be put up on the web in due course. Okay, so
you want me to lead on the first question, Rob?
Yeah, if you can just guide me to where I've got one box that says Q&A and I've got a chat box. So I'm looking at the Q&A screen. Is that?
Yes, if you look at the Q&A screen and look at the open questions.
Yeah, okay. So just while I'm doing that, I should introduce the panel that's going to help answer. So as well as myself, I've got Nathan Richardson and Claire Newland. Nathan is Associate Director for Research Programs Group at MRC, and Claire Newland is Director of our Governance and Policy Directorate. And Kath and Kerry, who are part of the Unit 2.0 team, as it's currently called, will also offer input as necessary. So back to you, Becky. Shall I just do them from the top then?
Yeah, if you want to, that'd be good.
Yeah. So one of the questions is in relating to the detail of the strategic priority and what might be considered under advanced therapeutics. I mean, I don't really want to get into too much detail on the three themes. I mean, the particular question is whether MRC would consider vaccines under advanced therapeutics. I think there is an approach to vaccination which would be considered in that area, but of course not all vaccines would be. But I think, again, you know, we will provide some defining text around each of these three themes, but we really do want applicants to think quite broadly in terms of the approach, and we're certainly not going to be restrictive in sort of assessing things. But you know, there will also be understandable boundary area questions which the office will help answer on a case-by-case basis as we go forward, but we will be providing detail in due course. Then the next question is, would you accept an application led by a PI who is from a subject area that does not normally sit within MRC remit? For example, Arts and Humanities Research Council. So the short answer is yes. We have got no expectation in relation to previous funding history or previous affiliation to any particular sector within the UK funding environment. What we want is to support the best science led by the best people. And it's however that is brought to us and that we can assess it that we make the decisions on. Okay, next one down is, with the move to key objectives, do you expect the award will have a set of defined deliverables within defined timescales? I think we would certainly need to understand a sense of what will be delivered during the 14-year period. I don't think we would imagine that we would explicitly go down a kind of traditional milestone and deliverable framework that you would see in a translational type of award. But, you know, I think it also depends on the nature of the application and the nature of the awards to be made ultimately. I mean, you know, there may be a requirement that there are a couple of you know, demonstrable milestones that need to be identified and met, for example. That's possible. But we would need to be fairly flexible. I think the key thing I would emphasize is it's a long-term funding period, 14 years. I mean, and you obviously apply with the first 7 in mind in particular. And I think it would be necessary to define where do you expect to get to on addressing your challenge by year 7. And to some extent, you know, what degree of confidence would we have at year 2 that you were getting there as well. And I imagine a scientific advisory board that was brought in to support this activity would be asking the similar questions as well. So I hope that gives you a sense. We don't want to be rigid on this, but we do need some definition. Okay, a question: can the CoRE award support a dedicated doctoral training program to align with the centre objectives? What we envisage at the moment is that we will provide some support for studentships in relation to the unit or centre award, but we would expect these to sit within an existing doctoral training partnership or an equivalent. We don't want to set up a bespoke arrangement for each individual unit and centre. I think there are good arguments for ensuring the quality of training support is done as a larger cohort, and many of the universities are running very, very successful doctoral training programs. So what we're anticipating here is an earmarked allocation to an existing DTP, and we understand that not all organizations host those, so there can be equivalents or partnerships created to deliver the same objective, I would say. Okay, next question. Mention a partnership with external organizations. Well, firstly, we're encouraging that. We're talking to certainly other parts of UKRI and the research charities, and have had some high-level discussions with industry groups as well, which will accelerate as we go forward. So we are very keen to encourage funding partnership where that makes sense. And again, one could envisage that as being perhaps on occasion as a core arrangement, such that this is a jointly funded centre or unit. And the second aspect is that, to some extent, bolt-on activities are identified that are funded by a partner in the normal way of things. So obviously, we are also talking to the other funders about thematic opportunities that might be of mutual interest as well. And so I think the answer to that question is we're very keen to explore the appropriate partnership opportunities, and we're certainly very encouraging of them. Okay, to what extent will the levelling up agenda influence our thinking? Well, I think the first thing is to say that we want to make sure that the whole process is very open to applications from across the UK, and for people to be able to propose and demonstrate to some extent the appropriate environment to undertake these activities. At the end of the day, we will be making funding decisions primarily based on the ability to answer the challenge that we consider to be an important challenge to address, and that all facets of this are possible. But we very much hope, by encouraging cross-institutional approaches, that will, to some extent, allow some degree of levelling up, because it may be that some of the more traditional universities in terms of established MRC funding and the Greater South East, for example, where there is a lot of capability and capacity that could be turned to these things that may not be present in an individual university in another place, but by coming together, that could clearly be assembled and very competitive in these programs. I should just say to my colleagues, do just chip in if you feel you can add value to what I'm saying or improve on what I'm saying, so don't be shy. Okay, do existing units have a preference? No, we have a unit portfolio, and we need to offer an opportunity for that portfolio to transition into the new style of funding. That's going to be a process over the course of the next 5 years. Many units are going into their final period of funding on the current basis, and they will be asked to consider applying under this new form of support. So that will be a managed process, but it will be a competitive process, and we fully expect to be funding lots of new activities, as well as seeing the transition of some units into this funding model in due course. Okay, I've already answered the vaccines advanced therapies question. Will there be any support available for the MRC for institutions putting in a full application? I'm not entirely sure what that question is coming to, but we won't. If the question is, would we be offering small funds to convene workshops or applicant networking or whatever, then the answer is no.
Yeah, I think we expect them to be self-organising within their institution and perhaps between institutions to really pull together the compelling arguments for MRC to put an investment down.
Yeah, thanks, Nathan. Next question. If applicants need to be substantially supported by other funding, how would early career fellows fit into this model? Well, I mean, the first thing is, you know, an early career researcher who's at a particular point of trajectory where they are capable of being considered a leader of something should be incorporated into the team if that's appropriate. The second thing is that we would expect early career researchers to be applying for fellowships and new investigator research grants or whatever it might be, alongside their incorporation into the bid in question. So, you know, I think again, what we want to see is a work program that encompasses both established PIs and the early career researchers who are bringing particular dimensions to this activity, and they will again be able to get some degree of core support, but be encouraged to follow their own you know, fellowship ideas through response mode funding. And I think, you know, it's important for ECRs to get their own independent funding at some level as well. So during the course of that period of time, I think it should be a beneficial arrangement for all parties. There's a question of percentage of salary support. I mean, all I would say there is we are prepared to pay the appropriate percentage for the amount of activity that's being done. But all we are saying is that we're not expecting to pay 100% salary support for anyone unless they are in a particular position where they can't reasonably expect to be competitive in other formats of funding.
And part of the thinking behind that is many of these units will be brought together through established PIs, and they will have a number of research activities that they're pursuing, perhaps only a component of which will be incorporated into the unit challenge area. You know, in that regard, only a proportion of their effort will be directed towards fulfilling the ambitions of the unit, and their other time and efforts can be used to pursue a broader portfolio of research. And that relates to another question I saw about whether PIs in units will be eligible for MRC grant funding through response mode. The answer is yes, because it's a portfolio approach that we're looking to pursue. And that external funding beyond the core should serve to complement, enhance, and add value to the core investment.
Yeah, thanks, Nathan. So there's a question about remit in terms of other cross-council activities or the NHR interface. I mean, you know, I think there are two different questions here. If there's a question that to some extent has been identified as being of interest to another council and an NHR and whereby co-funding might be considered, then that's an easy answer to that. Where it's MRC funding solely, I mean, obviously we wouldn't expect MRC funding to be providing support for something that's totally outside of our remit. But in terms of addressing a challenge and keeping that interface open, then obviously core funding could be justified on the basis of stretching the MRC's natural funding area to offer areas of opportunity for partnership, let's say whether it's NHR or another council. I mean, in the case that that's done, then that obviously might constitute some sort of milestone of expectation for successful delivery. But I think we would, you know, not want to rule out considering applications on a kind of understanding of what MRC can or cannot fund. It's about articulating the question, what would the funding be required to do in something that is centered around MRC's remit, and what are the opportunities to link to others and bring others in. The clear pathway to develop co-funding is really for the applicants to define, I would say. The funding call asks for bold, perhaps even paradigm challenging activity. Therefore, how would you get a good scientific advisory board under these constraints? Well, I mean, again, you know, I think setting something like this up, if you would assume by the time we've got to the case of agreeing the award, that all of those involved and people who will be seeing what being set up should be quite excited. And you would like to think that eminent people around the world who would have a perspective on this could be attracted to participate in an SAB. I mean, it's for the applicants to some extent to suggest the SAB that gives them the breadth and challenge around the area that they are suggesting. And I would have thought most applicants would have a pretty good view of who should be involved in that. But of course, you know, we would leave it open for the MRC or whoever else was a stakeholder in this to be offering suggestions if that was helpful.
A paradigm shift might be associated with a gap between disciplines or a coalition of different disciplines. And in that regard, you'd imagine that you'd want to have the broad thinkers, imaginative thinkers within those disciplines that might be able to input into your ambitions there.
Yeah. So there's a question about whether we would envisage cohorts being funded, and I would extend my answer to clinical trials as well. The short answer is no. There's the ability to get funding for cohorts, and the reason I mentioned clinical trials in the same breath is these sorts of investments require specific assessment and consideration in the broader context of what else is out there, what's the specific need, and so on. So we would imagine the unit or centre investments being focused on delivering a particular research angle that may well be levering a cohort that exists, and it may in itself provide an argument to establish a new arm of a cohort or some interaction. But the support for the maintenance of a cohort itself, which we would regard as infrastructural funding, would not be allowable. And similarly, I'm sure you understand, clinical trials can be embedded in research for sure, but again, there are processes and procedures that need to be assessed by clinical trials expertise type of review. Do you expect applicants to have a research program in the proposed area, i.e. that can it be totally new? Well, I mean, I think, you know, one would assume that the applicants applying to focus on a challenge would be identifying their expertise that would be contributing to answering that challenge. We would be, I mean, if I'm reading this question correctly, you'd imagine that the core researchers would largely be active in that area, but there could well be a case for someone working on a particular technology or a particular other concept that could be considered to offer a real opportunity if embedded in an appropriate environment, in which case they might not have direct research program in the area, but they would have direct research program in a technology or an approach that might be appropriate. But I think you know, it's obvious that these things have to be internationally competitive from the start. So it's about assembling the best team that can bring that expertise together. Expectations on the level of partnership and industry engagement will of course be needed to be tailored, but what would you like to see here and what's your aspiration? Well, I mean, I think, you know, industry, and we can conceive of industry across, you know, biotech, pharma, diagnostics, devices, digitech, and so on. And I think all are potentially valuable partners for either validating concepts or developing application and commercialization routes. So absolutely, we would be very interested to see engagement with industry, and certainly at the very least, I would say an idea of what is the trajectory for the knowledge outputs being of relevance to industry or other end users, if I can put it that way. And very much if there are conversations to be had with potential partners and industry that could help address the challenge and make sure that the outputs have really impact, then we would be very happy to consider that and work with that. And I think with all of these ideas, there is going to be potential to have feedback from the outline stage for those that are going to be invited in to stimulate applicants to look at areas that they could address or bring other partners in if that's identified. So I think that's the advantage of a two-stage application process. We could potentially build some strength in through that gap in between the outline and the full.
Just to add to that, I think we would like to see partnerships developed at multiple levels in accordance with the needs of the challenge in front of you. So that might be as part of a research activity, you build upon an existing relationship with a pharma partner, perhaps as part of some of the more detailed research activities, as sort of a very bottom-up approach. There might be a level above that whereby there's a stronger, more cross-cutting partnership established at a thematic level or even perhaps a unit level that you are going to pursue, that brings in a stronger contribution from those partners in a more multi-dimensional level. You know, and that would clearly be very attractive. And then, as Rob said, perhaps at the top level, there might be the opportunity of co-funding with the MRC as a funding partner. So I think we would look at all levels and opportunities to really prosecute your science and ambitions.
Yep, thanks, Nathan. So the next question relates to the change between identifying annual opportunities around identified themes and the transition to a longer term view of responsive mode ideas. There are two elements to consider at the moment. I mean, the first one is that we need to manage application numbers in a sensible way, and we need to some extent help the community understand what success looks like as well, and work through our own approaches and open up the options for research funders that might join in partnership. The second one is that we are also managing the transition of an existing unit portfolio, which, as I say, is a managed process over the next 5 years. So for that reason, the Major Investments Board advised that we should start off by focusing on particular themes where there was considered to be a particular opportunity that aligns with our own delivery plan that's been published. And certainly MIB will be establishing to some extent a work program that would cover ideally the next couple of years, such that the community can get sight of the ideas that we're thinking about. During, I can't precisely say when, but I would imagine that during the course of 5 years, we will move in the next 5 years, move to a more response mode approach with maybe encouragement in a thematic area or two alongside that. And then between now and that 5-year point, we will gradually transition. We do want to retain open the opportunity for very timely opportunities that may be to some extent novel and unique to be able to come in as well as the themes, and we'll be providing a bit more detail of that in due course. But you know, this is a long-term approach we are envisaging. We're currently modelling on a portfolio of between 30 and 35 of these investments at any one time, and that will take a period of time to build up. So we're starting with focus themes both to help manage expectations and identify immediate problems and pressures, and also wanting to move to more response mode such that we can really capture the best ideas and people can understand the portfolio gaps to some extent that they can respond to downstream. So it's not fully determined at this point, as you would have gathered from my answer, but it's something MIB is working on, and in the new year we expect to be able to communicate a bit more to the community about what future timelines and calls look like. So that covers the next question around what future themes will look like. We agree that the community needs as much notice as possible. And again, I will hope you'll realise from what I've said that even if you feel you're not being accounted for in this year or the next year, if you've got a good idea, there will be an opportunity for that to come into MRC in the next few years' time. Will you consider the current geographical distribution of investment to draw on expertise more broadly across the UK and address particular healthcare and biomedical challenges? I mean, I think, again, you know, in responding to a particular healthcare or biomedical challenge, we need to essentially address that through, is this the right team in the right environment with the right capabilities? And I wouldn't really want to look beyond that. You know, I think if there are particular reasons to host an activity in a particular region because of a local opportunity, and that can be articulated, and that will give a competitive edge to that proposal. I think what we are asking is that there is consideration in terms of the investment landscape across the UK in particular, but also slightly beyond, to make sure that what is being proposed is a unique challenge and something where we really need to do a concerted effort to achieve something that can't be readily achieved elsewhere or isn't being addressed elsewhere, even if currently the challenge is not being solved. So it's about the unique selling point of both the idea and the constituent parts of the bids that I think will be critical for this.
So certainly this new investment approach will give a really exciting opportunity to both refresh and diversify the types of science and health challenges that we pursue through our unit investments, but also an opportunity to diversify the spread of our investments across the UK, and the types of disciplines and science interests that we support through those activities. Just on the next one, research delivery service. So we're not, we don't have any plans or anything available by way of a design service. Should there be any questions that we can ask to help support you in the development of your applications, there's a route to feed those in, and we will support you in as much as we can. But we don't have a formal design service to help you pull together your ideas into a compelling application.
Yeah, and I mean, my understanding of the RDS is that it's really primarily geared to support advice on methodological approaches and the involvement of stakeholder groups and so on. I'd like to think at the level that the applications coming in for this particular opportunity that to some extent that should already be reasonably well understood by competitive applicants. Okay. So there's a question about whether shortlisted units at the first call can advertise for partners or investigators. I think we would certainly be open to evolution between the outline and the full application, as long as that obviously didn't substantially change the approach being proposed. So I think if the outline is sort of given feedback that then suggests that you might go and look for additional strength in an area or two, or alternatively that you just feel actually in between times we've been able to super boost our proposal by bringing in X, Y, or Z, then I don't see any reason to avoid that idea being taken forward.
But we won't ourselves be advertising those shortlisted for that purpose.
Yeah, thanks for the clarification. Can PIs in existing units apply for opportunities alongside their current quinquennium funding? The short answer is, in principle, yes. I mean, what's important is that the ideas and bids being put in are supported by the best capability there is to answer that challenge. If some of that capability already exists within an existing unit, then I think, in principle, that would be interesting to see if it can be applied in this direction. Why I say in principle, I mean, I think it has to be a joined up discussion with the current unit in question, and the director and the leadership team of that unit, of course, to understand just what are the implications for that in terms of that own thinking within that unit and its immediate sustainability or its future plans.
And you'll appreciate that we have to avoid any possible double funding. Although in most instances, I would imagine a new set of science challenges would be different from existing programs. They may not. We just need to make sure we are careful there.
Yeah. The next one asks about funding levels. I mean, what we've said is a typical unit or centre, and what we've modelled would be £3 million per annum. Clearly, if there is a small and beautiful idea out there, we would be very happy to embrace that. So I don't think there's any problem de facto in putting in a smaller bid. Of course, it's just a question of, you know, being sure that you can identify a challenge and how that will be addressed with the appropriate budget. So value for money is always an issue. If it can be done for less, that's great. The £3 million per annum, it is a cap in terms of thinking. I mean, we're not saying that there might be a special feature that requires that budget to be breached because of a special capability that might be required, that to some extent can't be fitted in within that budget, but that would be exceptional. So the £3 million per annum is a guide, but certainly lower is absolutely fine to consider activities on that basis. Will thematic areas be repeated in subsequent calls? I think that rather depends what we get. You know, I mean, the areas we've talked about are very broad areas. So again, you know, we've had this discussion with existing units or other applicants who are worried about their particular timing and so on. So I don't think you should take the view that just because there's one activity in this area where that area is fairly broad, that's it for all future time. Similarly, we are only expecting to fund 2 units in terms of the budget availability under the new call to be launched, and there are 3 themes. So by definition, one of those themes is not going to be successful. That may mean that there are very good bids, they're just not quite as competitive, or it might mean that the thinking in that area is to some extent not mature enough in terms of the review process that we've put in place. So if it was the latter, we may well want to revisit that thematic area with a bit more development. So I think we have to be a little bit flexible on this. But clearly, where we do fund in a particular area, and there's an activity set up, we would view that as being, you know, a leadership strategic investment, and other things that might be in similar space would have to some extent explain what they would be doing differently to that one. Okay.
In terms of sort of join up across units, whether existing or new, in terms of co-developing patient and public involvement strategies, I think we'd encourage and support that happening. And then on your second question about, you know, NGO and other partners helping to be more creative in terms of inclusive participatory approaches, then again we'd encourage these new units to explore those and looking for creative new ways and learning across different partners and communities of practice.
In terms of health inequalities, one could imagine how that could feed into a number of challenge areas as a sort of a major ambition theme, or as part of perhaps an underlying activity. Certainly one could imagine that being very relevant to mental health challenge area that we've got at the moment, and how different parts of the communities respond, how treatments are perhaps developed, how the biological and social components are brought together. One can see a very strong health inequality component to that. So I think it's about how you design your challenge area, and how some of these important cross-cutting themes perhaps get weaved in.
Yeah, and I think in multimorbidities, multiple long-term conditions is another area where there's a health inequality question. So again, we wouldn't want to be restrictive, but I think, as Nathan says, I wouldn't agree with you that the narrow focus of the current thematic areas to some extent rules that out, if that's the inference from the question. I think there is opportunity, and health inequalities is an issue that is very relevant to our strategic plan that was published a month or so ago. And we do expect these investments and other strategic investments that the MRC does to address these areas, such as health inequalities. So I think there is coherence across what we're doing and that opportunity.
And on the matter of transition of existing portfolio, we are working up more detailed guidance to engage with existing units and their university hosts on how they can best position themselves to transition into Unit 2.0, and where what happens perhaps if those applications aren't successful, and what are the transition arrangements of that science onto other funding mechanisms. So we will have some more detailed information to provide fairly shortly. But certainly at the moment, the themes are there, which may be opportunistic for existing units to bring their exciting bids forward. But as Rob said from the outset, there is also scope beyond those themes for really exciting and timely applications to come in. And certainly that provides an opportunity for our existing units to come in when best for them, so that we can consider them in a timely manner.
Yeah, and just to clarify, on the 8th of November, we have a dedicated webinar and Q&A for our MRC unit family, and for anyone who's a core member of an MRC unit can participate in that. So that will be focused specifically on some of the issues that are being touched on in that question.
Rob, we just had one more question that came through to me on an instant message. Which is, as a non-medical school modern university, it would be helpful to understand how we can engage with this call, e.g. as a partner or delivering a work stream, for example.
Yeah, well, I mean, to some extent, and I think Nathan has already said, we don't see our role here as matchmaking institutions, but I think as someone who feels they've got something to offer there, I think it's up to you to be proactive with some of the maybe geographically closely positioned universities to see if you can offer something to what they're considering. I don't think we've got any concern about whether you've got a medical school associated with you as a university or not. I mean, there are plenty of successful applicants to MRC that aren't medical school associated in terms of institutions. So I would just encourage you to to think about what you feel is a unique capability you can offer to either of any of those three themes or potential future opportunities, and make sure you started to have conversations with you know, other university partners such that they're aware of what you can offer.
Thank you. That looks like we've responded to all the questions. Okay, well, that's great that we've at least been able to attempt to answer the questions that have been fired at us today. We're obviously trying to make sure that the community is warmed up to what we're after. There will be more available information provided, obviously in the week 7th of November, where the call is going to be formally launched, and a lot more detail and guidance and issues around our expectations for what should be included or not. There is going to be continue to be a support team run through Kerry, Kath and Jess on the call, and we will be making other announcements as is appropriate as the process unfolds, and we have a clearer idea of any other additional elements to the outline process on these three themes in due course. So once the outline is announced, then we anticipate a fair amount of questions coming to MRC. We're very happy to answer those, whether it's through the central team or whether it's through the board and panel connections that some of you may already have. So I'll leave it there. Thanks very much for your attention. We will be putting the slides and the Q&A up in the not too distant future. And I hope this has been helpful. Please do encourage your colleagues to have a look at the detail that's emerging on the web around this. And obviously we hope we can answer any future questions that might occur to you. So thanks again. And if you are going to apply, best of luck with your bids.